The hearing on House Bill 22, no, wait a minute. Bill introductions. Are there any bill introductions? No, thank you very much. Representative Barth.
Thank you, Madam Chair. I would like to introduce into committee on behalf of the Kansas Department of Aging and Disability, RS 0902, an act concerning health and healthcare relating to healthcare facilities and requirements of the State Board of Cosmetology.
All right, thank you.
Thank you.
Representative Clifford.
Thank you, Madam Chair. I'd like to introduce 23 RS 0805 on behalf of the Kansas Department of Health and Environment concerning drugs and drug overdoses. I have another.
I think you've reached your quota, Representative, but we'll let you.
Can I pass it to Representative Turner, ma'am?
Go ahead.
A second bill, 23 RS 0771 on behalf of Vertex Corporation concerning sickle cell disease. Thank you, Madam Chair.
Okay. Any other bill introductions? Representative Reese.
Thank you, Madam Chair. This is House Bill RS 0733. This is an act concerning health and healthcare relating to prescription drugs, insulin drugs, and devices for the management of diabetes, providing price limitations and requirements, therefore under health insurance plans. This is on behalf of Representative Heather Meyer. Thank you, Madam Chair.
Any further bill introductions? This is your last day to introduce them, so if you didn't have an RS, you're out of luck. Now, committee, we'll go ahead and open up the hearing on House Bill 2262. Would you like to explain the bill? Reviser Abbott.
Thank you, Madam Chair. Good afternoon, committee. House Bill 2262 was sponsored by this committee. The bill would change the requirements to receive a license as an embalmer. Current law requires that a person complete a 12-month apprenticeship after graduating from a mortuary science program. The bill would change that so that a person could complete 6 months of the apprenticeship before enrolling in a mortuary science program, and the remaining 6 months after graduation. The bill would take effect upon publication in the statute book. Madam Chair, I'd be happy to stand for any questions.
Committee, are there any questions of Reviser Abbott? All right, seeing none, thank you, Scott. Appreciate it. All right, committee, the first proponent that we have and the only proponent that we have is Pam Scott, Executive Director of the Kansas Funeral Directors Association. Welcome to committee.
Thank you, Madam Chair. I am Pam Scott, the Executive Director of the Kansas. We asked for the introduction of this bill. Currently in Kansas, to obtain an embalmer's license, you have to complete 60 hours of college credit, including a 12-month course of mortuary science study from a mortuary science school. You have to pass a national board exam, plus you have to serve a 12-month apprenticeship. This House bill would allow a applicant for an embalmer's license to serve a split apprenticeship. Right now, the apprenticeship is served after mortuary science school and the national board exam is passed. The split apprenticeship would allow 6 months of the apprenticeship to be served prior to attending mortuary science school, with the remaining 6 months served after graduation from mortuary science school and passage of the national board exam. Nebraska has a similar law, and a lot of states around the country allow part of the or all of the apprenticeship to be served prior to mortuary science school. The first 6 months would be under the direct personal supervision of a licensed funeral embalmer. The last 6 months, if you chose a split apprenticeship, would be served under the personal supervision of a licensed embalmer. Kansas, like other states, are seeing a shortage in the number of embalmers that are available. We believe that providing a split apprenticeship would be beneficial for those entering the profession for a couple reasons. Number one, it would weed out applicants who later determine an embalming profession is not for them after going to mortuary science school. And secondly, it could shorten the period of time in which it takes for an applicant to become licensed. Oftentimes, potential embalmers attend mortuary science school without really having a realistic expectation of a practical experience in a funeral home. They may decide to get in the profession because maybe they're intrigued with death. They may be a very empathetic and caring individual that wants to help others. They may enjoy science. But they've never had the opportunity to work in a funeral home or around dead bodies, much less embalm and reconstruct them. So sometimes they get in, they decide the profession's not for them, they can't deal with death, especially those cases where it's a child who has died, or say they're reconstructing a individual who's in a serious car accident, so the family can view them and say goodbye to them. So, you know, they make this decision sometimes after they've spent a lot of money going to mortuary science school and spent a year of their life thinking they were going to want to be in that profession, and they're not. So, also the legislation could shorten the time for those first 6 months. They could be getting some of the underlying courses they need to actually be admitted and attend mortuary science school. Kansas has one mortuary science school. It's Kansas City, Kansas Community College. That's where I think most of the embalming students go. There's also one, University of Central Oklahoma and Des Moines, or the others that are semi-close. But it is a 12-month course of study in mortuary science. So those are really the two reasons behind. We want to bring more into profession. We want to make it easier for people to become licensed embalmers students. So we urge you to support House Bill 2262.
Thank you, Pam. Are there questions of Pam? Representative Gardner?
Thank you, Madam Chair. Could you give us some even rough idea how many people that under our present system enroll in and complete the course and then drop out of the profession within, you know, the first 4 or 5 years after they graduate?
Yeah, I really don't have any statistics or numbers. Those are kind of hard to track, but I do hear it from our members all the time. Someone will start and just decide, you know, it's not for them. You know, I have heard situations where it's a little surprising, but when they start working for the funeral home, they're surprised they have to be around dead bodies, which concerns them, and they can't take, which you would think it would be obvious, but apparently it's not. But I don't have statistics, just not something we keep. But it's just, we had a task force this summer trying to find ways that it would make it easier for people to become licensed, and we got a lot of feedback, even though I don't have any specific numbers, from people thinking it would be easier on individuals. Plus, it's something that probably over 50% of the states allow this right now. Sorry, I don't have statistics, but.
Thank you very much, and thank you, Madam Chair.
Representative Blex?
Thank you, Madam Chair. Thank you for your testimony. I think the apprenticeship ahead of time is really a good thing. I think knowing what you're getting into is an important thing. I had a niece that went through that and then decided later she just couldn't handle it. Now, can you tell me do you have any idea on the school that's in Kansas City how much credit they'd get for a portion? You talk about 30 hours to complete the course. If they do that 6 months apprenticeship, do you have any idea what kind of a spin down that would do on the 30 hours? Is that going to be, now they'll have 24 hours, is it going to be 6, or do you know? Just too early
Well,
to tell?
actually, you have to have 60 hours of college credit. 30 of that, or 12 months of that, is mortuary science school.
Well, I'm talking about the way I'm reading this, it says the apprentice could also use that time to complete a portion of the 30 hours of preliminary college credits required to enter mortuary science school.
Oh, okay.
Do you have any idea what kind of that, how much time that apprenticeship would reduce, that 30 hours?
Depends on how many college courses they want to probably take online or what they have time to, if they go to night school or something like that, just how hard they want to work to get those 30 hours. I wouldn't think they couldn't get more than half of it probably prior to, which is pretty much a full-time student.
Okay, thank you for that.
Representative Turner.
Thank you, Madam Chair, and thanks for your testimony. I'm trying to understand the difference in the supervision requirements here, because you're saying currently they must serve 12 months under supervision, and then it changes to 6 months under personal supervision and 6 months under direct personal supervision.
Right.
Help me with what all that means. Thanks.
Direct personal supervision means that there has to be an involvement or physically present during that period of time. And someone who's just going to work for a funeral home who hasn't gone to mortuary science school, I think it's more important that that embalmer needs to be physically present to help train that individual. A lot of our students they have completed said that's probably apprenticeship is in some ways as valuable as school, learning how to embalm, reconstruct, even though you do have a practicum during mortuary science school where you get some of that. That's important. Once you finish school, taken the exam, then you just need personal supervision, which the embalmer, supervising embalmer doesn't have to be present all the time for that apprentice.
And how is it different from what it is now? Do they currently need to be there?
No, they
directly
don't,
or
but that's
not?
because the entire one-year apprenticeship is served after they've gone to mortuary science school and after they've taken the national board examination.
And is it just a time element, or is there some metric, a test? Is it just time? Is that the only
The
criteria?
apprenticeship is just time. You've really taken the exam after you've passed mortuary science school, and the national board exam is an exam that embalmers all across the country take. It's administered by the conference of examining boards, which is made up partially of regulators across the country, plus some other people. So it's a pretty tough exam to take. The national pass rate's about, I don't know, I think it's in the 60s. Is that correct? No. In Kansas, though, we're proud to say all the students at Kansas City, Kansas Community College, they had like a 92% pass rate, which was really, really good. We were, I think, the top school in the country as far as having our students pass the national board exam.
Thank you, Madam Chair.
Committee, further questions? Representative Barth.
Thank you, Madam Chair. Thank you, Pam, for the presentation as well. And going over as a proponent here, can you tell us, do you have the Kansas City, Kansas Community College on board with the change of doing this 6 months? Kind of, do we have a program where they're going to be able to weave it in, or is this going to be something that's kind of a surprise to them? Or even if it's not a surprise, are they on board with it?
No, I've been talking all along with the head of the mortuary science school over there, and he's supportive of it. We didn't want to come. Their main concern is they didn't want to lose students or anything, and actually it makes it more positive for them to get students. But yeah, they are aware of it and supportive of it.
So it does allow for them possibly to finish the program a little bit sooner than,
Right.
okay, than post it. Okay, thank you.
Committee, are there further questions? All right, seeing none, and I have no opponents or neutral testimony on it, so thank you, Pam, for being here today. So that will close the hearing on House Bill 2262. Without objection, we'd like to work House Bill 2262. Is there any objection? Seeing none, Representative Epley.
Yes, Madam Chair, I would like to move that we pass House Bill 2262 favorably for passage.
Motion made by Representative Epley to pass, seconded by?
Madam Chair, Dr. Clifford, I'd like to second the motion.
Okay, Representative Reese already did.
She's just faster than I am. Thank Madam Chair.
She was touching my arm. I'm sorry. Okay, motion made by Representative Eppley, seconded by Representative Reese. Discussion, comments on House Bill 2262. Seeing none, Representative Eppley, you may close your motion.
I close.
All those in favor of passing out House Bill 2262 as presented, in favor signify by saying aye.
Aye.
Opposed, no. Ayes appear to have it. Ayes do have it. Motion carries. House Bill 2262 is now passed. Now we will open up the hearing for House Bill 2263 and Revisor Abbott.
Thank you, Madam Chair, members of the committee. House Bill 2263 was sponsored by this committee. The bill would amend current law that allows certain pharmacy personnel to administer vaccines. Current law allows a pharmacist or a pharmacy student or intern working under the direct supervision and control of that pharmacist to administer vaccines, flu vaccine to someone 6 years of age or older, and other vaccines to persons who are 6 years of age or 12 years of age or older, pursuant to a vaccination protocol and subject to certain record-keeping and training requirements. The bill would simply add pharmacy technicians to the list of persons who are able to administer vaccines under those conditions. The bill would take effect upon publication in the statute book, and I'd be happy to stand for questions.
Thank you. Are there questions for Revisor Abbott? All right, seeing none, thank you, Scott. Okay, now we will call our first proponent on it, and it'd be Aaron Dunkel, Executive Director of the Kansas Pharmacists Association. Welcome to committee, Aaron.
Thank you, Madam Chair. It's on. And committee members. My name is Aaron Dunkel, Executive Director of the Kansas Pharmacists Association. Just give you a few kind of highlights and why we brought this bill up, or when the session began. The bill will allow pharmacies the flexibility in state statute that we've had through the Public Readiness and Emergency Preparedness Act, so the PrEP Act, since October of 2020. And the reason those were put into place originally was we knew there would be this huge flood of COVID vaccination and demand. And they knew that really the staff that was available at the time probably would not be able to handle the volume. And so through the PrEP Act, one of the amendments, they went ahead and they brought in pharmacy technicians as an approved vaccinator through the administration of vaccine. What this bill will do is it allows appropriately trained and certified pharmacy technicians to administer vaccines under the supervision of a pharmacist if that situation is allowed under the conditions of the vaccine protocol that the pharmacist is working under. As part of this, the ages of the patients and the vaccines that can be given will be the same as those that the supervising pharmacist can give. Since the PrEP Act came out, this is where we kind of had a surprise. I can tell you when we first had the PrEP Act amendment come out, we reached out to the KU School of Pharmacy and worked with the pharmacy faculty over there that trains all the pharmacists on vaccine procedure and protocol, and worked with them to put together an educational program, which was one of the requirements in the PrEP Act, and it's a requirement of the bill also. We went through, got that developed up, had it approved and ready to go by February of 2021. And since then, we've trained a little bit over 450 pharmacy technicians here in the state of Kansas. The ones we've trained have been largely employees of local independent pharmacies. And we know that all of the chain pharmacies in the state have also trained folks through their own training programs. So we've had literally hundreds, and probably now in the point where we're in the low thousands as far as pharmacy technicians that have been trained and certified to do vaccine administration in the state of Kansas. Since techs have been given the ability to do this, and this is just on the folks we've talked to on the independent side, we know that they've administered tens of thousands of vaccines since February 2021. And what that's really allowed the pharmacies to do is allow them to have trained personnel safely administering vaccines and really being able to work with those folks to be able to do the large vaccination clinics and be able to get people, when they came in and wanted a vaccine, we'd have staff available and ready to be able to do that procedure for them without having to sit and wait for a pharmacist to become available. I do want to point out, as we're going through our conversations with external partners, it was brought up that there was a little bit of a concern. There's kind of a strange loophole in the law that if a student is part of a program in a high school or in a self-learning program, they can basically put in a request to the board and be able to be registered as a pharmacy technician under the age of 18. We wanted to make, and we agreed with the concern that that probably wasn't really our intent, that what we wanted to see is that be folks over 18. So when you get to the point where you're ready to work the bill, we do have an amendment that's ready that would specify that the pharmacy technicians have to be over 18 years old to make that work. One of the things we also saw, and it's one of the reasons we were really adamant about bringing this to you guys, is like a lot of other healthcare providers during COVID and since we've kind of leveled off a little bit, is we saw a lot of folks leave the profession. We saw a lot of pharmacy technicians that decided they didn't like the stress, they wanted to go do something else. And a lot of the folks that we talked to, and this is kind of anecdotal, has been we traveling around the state the last year and asking people, you know, how do you feel about it? How did it work? How do you think it's going? We have a lot of our pharmacy technicians that were trained that mentioned almost universally to us that it really helped with their job satisfaction. They weren't just in the back filling prescriptions and helping with that. They were really part of the vaccination team, and they saw the immediate impact and and felt value in what they were doing above and beyond what their normal job is, or had been up to that point. But anyway, that's the end. Be happy to stand for questions at any time.
All right, committee, are there questions for Aaron at this time? Representative Orpesa, excuse me.
Thank you, Madam Chair. I just had a few questions. So when the technician is giving the vaccine, where does the liability fall?
So the liability will fall back on the pharmacy overseeing the technician, and it's covered under the professional liability insurance.
Okay, I have another question, Madam Chair. My second question was, is there going to be continuing education for the pharmacy techs? I know everybody was trained during the pandemic, which was fabulous, but is there going to be ongoing, so if there's turnover, new people?
Yeah, well, we're planning on continuing our pharmacy technician training program, and I know a lot of all the chain pharmacies will do the same, so if they have new staff that comes on that needs to be trained, they'll be able to do that. And most of our folks, if there's any real change in the administration, so if there's a new type of drug or something that has to be administered in a different way, our folks, the intent is that they'll train their staff up internally.
Is there going to be continuing education attached to the training, either yearly, every couple of years, 3 or 4 years?
No.
No.
Representative Barth.
Thank you, Madam Chair. And I didn't catch your name.
Oh, Aaron Dunkel.
Aaron?
Yes.
Okay, thank you, Aaron. So I have a few different questions for you. Can you tell me a little bit about today as it stands for a pharmacist in a pharmacy today, what the rules and the law is around informed consent with all of the different risk factors?
It's the same that it would be if they went to a doctor's office. They're required to give the vaccination information sheets. Required to have that conversation if there's something specific about the vaccine to be concerned. But it's the same as it would be at any other provider's office.
And what all is on that sheet?
I could provide you some examples. I'm sorry, I can't pull it off the top of my head.
I would love to see the exact example, what you're talking about, would be
Okay.
great. What about information on reporting to VAERS, any kind of vaccine injuries and things of that nature? Can you tell me a little bit about the processes currently for pharmacists?
Again, it's the same as other providers, so there's a bit of information that's given. Usually it's tied in, it's on the VIS, isn't it? Yeah, it's on the vaccine information sheet.
And then are you, as pharmacists, handing out the inserts with the ingredients and risk factors, as well as what drugs that this cannot be taken with as well? Is that?
Again, it's all on that vaccine information sheet.
Okay, I think that we need to see that sheet then for sure. Representative Orpez asked a good question. You said the liability is to the pharmacy. What is that liability exactly?
Well, it's tied into the pharmacist liability insurance, covers any liability that comes up, the professional liability insurance that they have.
And then one of the other questions I have is there is a difference between the COVID vaccine compared to all other vaccines. It sits under emergency use authorization. I actually think that the date is expiring. I don't really know what that looks like to date. So that will change liabilities and things around that as well. What are your guys' thoughts around that?
Again, you know, anything that's tied back to ACIP, the the committee that makes those determinations and CDC's recommendations. Those are usually the drug or the vaccinations that are in the protocols that the pharmacist signs with the doctor. And so, it's just taken care of in that direction. So as long as it's tied into an approved medication or an approved vaccine, or it's tied to like an EUA, we look at that information.
Okay, I still have questions that need to be answered once they provide that information. Thank you.
Representative Berquist.
Thank you, Madam Chair. Just going back in history just a short time, however long that is, how long have pharmacies themselves been able to administer vaccines?
I think our bill on that was either 10 or 12 years ago.
10 or 12 years ago?
Yeah.
And under the same conditions then that you're asking for now for the assistance?
They have a much longer education program. The one we're looking at that we did for the pharmacy technicians was really just about administration and some of the safety concerns and knowing how to recognize anaphylaxis and things like that, and how to actually give the physical shot. What the pharmacists go through is it's a 20-hour training, and it's part of their schooling now while they're in college still, that goes over things like cold chain management. It's a lot more detailed in the management and administrative side of the vaccine.
And just a follow-up question, Madam Chair. Okay. So for the information that the pharmacist understands about the reactions and about reading those reactions and what to do, a technician, how would they know, how would they be educated enough to know if there was a reaction or if there was a question when the form was being filled out saying, I understand these conditions, as the representative asked about the information?
If there's something that's asked of the technician, one of the requirements is that, and it ties back to the relationship between the pharmacist and the technician, the pharmacist has to be immediately available. So they're on site, they're there. Technicians can't give vaccinations without their sponsoring pharmacist there with them.
And just one more. Is there an urgent need for technicians to be able to do that? Are we short of time for it to happen?
Yeah, as we were talking to our folks, and I can tell you, before this all happened, we had a lot of conversations about asking and coming forward and asking for a statutory change to bring techs in as administrators back then. We're quite honestly, our industry is really kind of split on whether that was a good idea or not. Through the COVID situation and being able to have these folks trained, what we've really found out is that the folks that have decided to have their PTs, their techs trained, and be able to have them as part of that workflow, that it has freed up the pharmacist to be able to do consultations and deal with patients that are a lot more complicated than just somebody coming in for a quick vaccination. And especially when we were dealing with, having these large vaccination events, whether it be COVID or flu, being able to have 2 or 3 or 4 or 6 folks there as opposed to 1 or 2 meant that they were able to turn out and get folks the vaccines when they wanted them, where they wanted them.
Thank you, Madam Chair.
Representative Clifford.
Thank you, Madam Chair. I received a vaccination from my pharmacist in the summer, and I knew her, so I was very confident. But I was back to a pharmacy over the weekend, and there was a young man at the cash register, and were he coming at me with a needle, I would have had questions. But so how are these folks identified to the public so we know that they've had the training?
So through the licensure, we know that anybody that's going to be giving you a vaccination is going to be a certified individual. And the way that they're selected on who gets sent to training is usually by the owner and or the pharmacist at the pharmacy. So they're only going to send the folks. Our intent, our hope is that they only send folks that they believe are the ones that are the most qualified. A lot of times you have folks that have been with them for a long time. They've a lot of times gone through and have the a national certification level. It's not somebody that's usually working as a clerk or only in the pharmacy part-time.
So there'll be no badge they'll wear or some identifying information?
Nothing identifying them specifically.
Okay. Thank you. Thank you, Madam Chair.
Representative Reese.
Thank you, Madam Chair. With this added job duty to these technicians, and I'm glad to hear that there is a selection process to choosing who's going to do that. Is there also a bump in salary for that?
Moving forward, I'm not sure if there's anything that's an official bump. What we've seen over the last 36 months, is that a lot of technicians have got increases in pay because of the competitive nature of the environment for somebody with that kind of level of skill set.
Thank you.
Representative Blacks.
Thank you, Madam Chair. Thank you for this. Of the number of pharmacies in Kansas, how can you have an approximate number of how many pharmacies are actually participating in this program and doing it? And a second follow-up would be, has there been what's the number, has there been an increase in liability claims since we've been doing this?
What we were told is there's been no liability claims. There's been nobody that's sued a pharmacy over a vaccination to this point. And in the states that have had this for a little bit longer, that had some of it before COVID, we didn't see it in those states either. As far as the total number of pharmacies, I really couldn't tell you, Representative, because I'm not real sure on the chains, how many of the chain stores. I know a large proportion of them have trained technicians, but I don't think all of them do. And then I can tell you, as far as the ones that we have on the independent side, the ones that we were training, of the ones that do vaccination programs, we're probably running about 80% that had technicians trained.
Thank you for that.
Committee, are there further questions? Representative Bryce.
Thank you, Madam Chairman. Mr. Dunkel, I just wanted to dig down a little deeper. The previous representative asked about liability, and are there physicians with standing orders on, you said the pharmacists were liable and they had liability insurance. Are there standing orders from physicians, or how's the practice of medicine there? Is it, are there physicians that write the orders and then the pharmacists carry that out?
So what there is there's a relationship between a pharmacist and a physician on a vaccine protocol. And so I've seen them anywhere from 6, 8 pages all the way up to 40 and 50-page documents that outline each individual vaccination that can be given, the age group that it can be given to, and who's part of that protocol within the pharmacy. And so that's how we have it structured, and that's what allows the pharmacist to give the vaccinations.
And I would assume that physicians then are liable, if someone would have an adverse reaction at that point. Are nurse practitioners able to give that medical supervision, or is it just MD, DOs with medical licenses?
Right now, it's just MDs and DOs.
Okay, thank you.
Committee, are there further questions? Who? Barth. Representative Barth.
Thank you, Madam Chair. Follow-up question I thought of from what you have talked about, and the others have asked questions as well. Something I think pharmacists are highly intelligent and know a lot about medications and know about diagnosis and a lot of different things and ways that they can help people. Same a lot with the doctors as well. One of the things I know that I value as a patient going to a doctor is that I'm provided alternative options and choices in addition to just getting a specific vaccine or shot. And so I don't know where that stands with somebody who's a tech who maybe doesn't have the full education to be able to do that, provide those choices, as my health and safety is the ultimate goal. And me as someone voting on this is my ultimate goal, to make sure that we have that for everyone as well on informed consent of options and choices. So can you just explain that a little bit, please? Thanks.
And a lot of that's going to be derived from the conversations between the patient and whoever it is that's treating them. As far as a PT or a pharmacy technician, what's involved in some of the education is like, look, if you start getting asked questions that you don't know beyond just the administration of the vaccine or what's on the vaccine information sheet, that's when they're trained to hand it off to the pharmacist. And there are certain circumstances where there might be some conversations had on treatment or alternatives, where even pharmacists will refer back to a family physician or a general practitioner.
Just a follow-up to that. That sounds like the responsibility is on the patient to ask the question or even to know to ask the question versus the information being offered on all of the, the options and choices, or even explaining any of those things to them. I don't know if there's enough rules around this or how it would work is what I'm kind of going at. I don't understand how it would
There's
work.
not a series of documents to hand someone to say, okay, you want the pneumococcal vaccine, and here's not only the pneumococcal vaccine, but all the other alternative treatment possibilities to receiving the vaccine. We don't have anything like that.
I'll do that. Okay, thanks.
Are there further questions? Okay, I might point out Revisor Abbott is very good at what he does. So in 2002, we allowed the pharmacists to start giving these shots to adults. 2007, it was students and interns. 2010, it was the flu vax to children. And I believe that's 12 and above and then 2017, other vaccinations to 12 plus. So it's been kind of a graduating process that we've been doing. It's not something that's brand new out here on the horizon here. So any other questions of Aaron? All right, seeing none, thank you very much, Aaron. But Representative Ellis.
Thank you, Madam Chairman. There's no refresher course in the bill. So once you get qualified, you're 15, 20 years, you're good.
Correct.
Okay, thank you.
Yeah, and I just, again, I want to go clarify, we've been doing this back since 2000, so that's not something that's brand new. Representative Turner.
Thank you, Madam Chair. That's kind of the history of the vaccination, but I remember we passed something last year that allowed pharmacists to give other shots. So there are shots given by pharmacists. This bill only covers vaccination shots. Is that correct? Okay, correct. All right, thank you. I just wanted to clarify.
I think the one that we worked on last year may have had to do with some insulin. I think, it seems like to me it had something to do with individuals that could give the injections themselves, but they may not feel comfortable doing it themselves, so they would like to have their pharmacist to do it. I think that might be what you're thinking. I don't remember exactly, but that may be it. And I bet before we get done with here, Revisor Abbott will show us. Representative Epley.
Thank you, Madam Chair. Just for clarity, there isn't any refresher course for any of these other entities listed to get a refresher course on vaccinations or other shots. So I don't want to get too bogged down in that optic today. That's all. I just want to say that. Thank you.
All right, any further questions? All right, Aaron, thank you very much. Appreciate it.
Thank you.
Next conferee we have as a proponent is Kaylee Rains. Did I pronounce that right? Callie?
Close it. Hi, Madam Chair.
Oh, coming in virtual.
Yes, my name is Callie Bushyhead Rains.
Okay, welcome.
Hi, I'm actually a certified pharmacy tech at a small independent pharmacy down here in South Central Kansas. And I'm one of the ones that was chosen to get the training to administer the vaccines. I can't tell you how many thousands of vaccines I have given, mostly through satellite clinics that we've had in Sedgwick and Cowley counties. I feel like it really lightened the load of the other medical professionals that were really, quite honestly, COVID really bogged them down. I mean, the nurses, the doctors, they got hit hard. And I feel like that's when the pharmacies were able to step up and help the medical community. But with that being said, the pharmacists alone couldn't have given all these vaccines. We were luckily able throughout the pandemic, because of the PrEP Act, to stand next to the pharmacists and, administer these vaccines to the public. And, even in the pharmacy setting, it's been able to lighten the workload of the pharmacists themselves, because there are certain tasks that only pharmacists can do. And if you have, for example, we have a community college here in town, they bring in 15 athletes all at once to get vaccinated. Well, our pharmacist here has phone calls he has to take. He's got to check prescriptions. He's got people wanting to talk to him to counsel on medications. And, and then you have 15 athletes come in for vaccines as well. So it's definitely a time saver to the patient as well as workflow for the pharmacy. In regards to how you can tell a technician from a pharmacist, we all wear badges, and it has our name and our title on there. So you can tell when you walk up to me versus one of the pharmacists by reading the badge if they're a technician or a pharmacist.
All right, thank you. Are there questions for Callie? All right, seeing none, thank you for being with us here today. And the next conferee we have is Darren Price, pharmacist. Welcome to committee, Darren. Did I pronounce that correctly?
Yes, ma'am, you did. Thank you, Madam Chair. And I'm also virtual. I'm here next to Callie today. Thanks for having me, and thank you, committee members. So the last, again, my name is Darren Price, and I'm a pharmacist. Graduated from the University of Oklahoma in 2008. So I've been a pharmacist for 15 years now. And I own 6 small community pharmacies in South Central Kansas. And I'm here today to support House Bill 2268. The past 2 to 3 years have been very challenging, not only for pharmacies, but for, the medical community in general. We've been dealing with a pandemic. Specifically in pharmacies, we've been dealing with declining reimbursements from pharmacy benefit managers. And we've also had staffing issues as well because of those declining reimbursements. So there's not as many pharmacists graduating from pharmacy school today as there has been. And so really our pharmacy teams have had to evolve and do different things and step up to meet the needs of the public during this pandemic. And one of the people that have stepped up are pharmacy technicians. Pharmacy technicians have always been invaluable to the filling of prescriptions, the handling of medication, and multiple areas in the pharmacy where they really help us out. That role has continued to evolve to vaccines. During the last 2 to 3 years, our pharmacies in South Central Kansas have administered, I think, around 50,000 vaccines. Like Callie stated, many of those have been off-site at bigger companies that have asked us to come in and vaccinate employees. Some of those companies include Dole Foods, Johnson Controls, and some of the bigger public school systems in the greater Wichita area. And without the help of pharmacy technicians, there is no way possible that we would have been able to accomplish those tasks. For our 6 small pharmacies, we probably have around 30 to 40 pharmacy technicians that have become certified and trained to be able to give vaccines. We have really detailed workflow processes. So when a person comes in and asks to receive a vaccine, like Aaron had stated, we give them BIS statements. If they have any questions whatsoever, they have access to the pharmacist to answer those questions. And we don't give vaccines without 100% patient approval. So, anyway, again, I'm here today to support the bill. And as a small business owner and a pharmacist, I highly regard the pharmacy technician industry, and I'd be happy to answer any questions too. Thank you.
All right, thank you very much. Are there questions for Darren? Representative Berquist.
Thank you, sir, for speaking to this matter. 2 questions for you. The pharmacist, I believe you said something to the fact that the pharmacist assistant or the technician has been very valuable over the years and helping to fill prescriptions. Do they actually fill prescriptions, or did they just do background work?
Yes, sir. So in our pharmacies, when a person comes in with a prescription or when a e-prescription comes in, the pharmacy technician is the one who inputs the prescription and usually the one that actually counts the medication that goes into the bottle. And then the final check of both the prescription and the right medication is done by the pharmacist. So every medication that leaves the pharmacy is usually touched by a pharmacy tech and a pharmacist.
Okay, just to follow up, when you say that back to the patient coming and wanting a vaccine, during this past 2 or 3 years, the idea of wanting a vaccine a lot of times amongst the people I know has been that somebody on TV told them they need to get a vaccine, they need to get the booster. And so that may be the only contact they have. And if they're able to bypass a doctor and go to somebody and say, hey, I need that booster, then that seemed like that may amount to consent to the vaccine. Is that correct?
I love it when patients come in and ask really difficult questions. You know, I love to explain just the facts. You know, this is the vaccine. This is what's in it. This is what it protects against. This is the benefits. These are the potential risks. All of those things. You know, we love to explain those things to patients. So
Do people do that very often? I'm sorry to interrupt you, but do
Yeah.
people ask you very often?
Every single day.
Okay. All right. Thank you, Madam Chair.
Committee, further questions for Darren? All right, seeing none, thank you very much. Committee proponents, we do have two written-only proponents, Alexander Blasey, Executive Director, Kansas Board of Pharmacy, Ryan Erzik, Public Affairs and Government Relations with Walmart. We have one neutral, which is Rochelle Colombo, Executive Director of Kansas Medical Society, and no opponent. Did you want to do testimony? Okay. Well, I guess it doesn't say written only, so that's my fault. That's on me. Welcome to committee, Rochelle.
Thank you, Madam Chair, members of the committee. I'm Rochelle Colombo. I'm the Executive Director of the Kansas Medical Society, and I am here in a neutral capacity, and I'll be very brief because there's been good discussion about the background of this bill as well as the protections that have been placed over the year for the administration of vaccines. It is the position of the Kansas Medical Society, which represents physicians all across the state, that in an ideal setting that all vaccinations would be provided by a primary care provider and that all patients would go and seek that. But we do believe in the importance in the public health in vaccinations. And so there have been efforts to allow for further administration of vaccines over the years. And you heard those outlined by Revisor Abbott, and those are correct. The most recent change to the law was in 2017 when the pharmacists came to the Medical Society and said, can we please look at the vaccination laws and look at lowering the age that allows that pharmacists are allowed to administer vaccinations. And those were ongoing deliberations that were really carefully considered to protect patients and to make sure that we balance the need to broaden the access to vaccinations with protecting patients. So some of the questions that have been asked here today are very relevant. This is consistent with what pharmacists are allowed to administer currently today, which is vaccines, the flu vaccine to those 6 and older, and other vaccines to those 12 and older. This does not include state-required vaccinations and catch-up vaccinations, which really need to go through a physician's office so that we ensure that those children between 6 and 12 are getting a comprehensive evaluation and they're getting the care that they need and having some of those conversations that have been discussed. But for someone 6 or older wanting the flu vaccine, now a pharmacy technician can also administer that the same way a pharmacist could. This is, as was mentioned by Mr. Dunkel, under the direct supervision of a pharmacist. It does require training and oversight. And we believe that that appropriately allows for access to the flu vaccine without jeopardizing any patients. So we, while we would prefer that all patients were seen by a primary care physician as a point of access, we do not have objections to this bill. And I really wanted to come before you to tell you that we've appreciated the way the Pharmacists Association has approached this. They reached out to the Medical Society. We sat down and the professions talked about what would be the right balance and how to adjust the proposal in a way that did protect patients and encourage the best care. And they made some changes to the proposal before they brought it to you. And we very much appreciate that and think that that leads to the best policy possible. So they limited the age range. And the only other concern that we had that came to us after the bill was introduced, that right now pharmacy technicians can be under the age of 18. And so we asked that this would be amended to say that a pharmacy technician cannot be under the age of 18 granted these privileges. And they have said that they would support that and offer that amendment. And we appreciate that and believe this represents fair policy that protects patients. So just thank you to the profession and to all of you for allowing us to work with them to try to achieve good policy. And with that, I would stand for questions.
Committee, are there questions for Rochelle? All right, seeing none, you must have done a really great job, so thank you there. So I don't have anyone else on the bill And I might point out is that one of the things that we are dealing with, and it's across the country, but I know it's starting to hit Kansas pretty hard, and that's the number of pharmacies that are closing on weekends or shortening their hours. I had here a few weeks ago, had a new script called in on Friday. I said, I'll be in to pick it up on Saturday because I called them to make sure it was going to be available. And they said, you can't get it till Monday because they're rotating. That happened to be CVS. I know that Walgreens has been, shutting down. It's also been something that's easy for individuals to, whether they're in at Target, Walmart, CVS, or Walgreens, to be able to stop in and get their, get their flu shots without having to set up appointments and stuff. So these are things that have been going on for a long time. We're not talking the COVID vaccine right here, folks. We're talking the other ones that we already have out there. So at this time, we'll go ahead and close the hearing on House Bill 2263. And at this time, without objection, I'd like to go ahead and work House Bill 2263. Is there a motion on the table? Representative Epley?
Yes, Madam Chair, I'd like to move that we pass out House Bill 2263 favorably for passage.
Seconded. Representative Clifford?
I second.
Discussion, comments. Representative Epley?
Madam Chair, I have an amendment to this bill, please.
Read your amendment, please.
My amendment is on line 8.
Oh, wait a minute. Scott's got it in writing to hand out.
Thank you, Scott.
You can go ahead and explain it.
Yes, ma'am. This just addresses the agreed-to change that we'd already discussed, which is on line 8, after who is, to insert the words 18 years of age or older for a technician, so
Okay.
that they'll be 18 years and older.
And working under the direct supervision and control of a pharmacist.
As is outlined in the bill. Yes, yes,
Okay.
Madam Chair.
All right. Is there a second on the amendment?
Clifford would
Seconded
like to
by
second.
Clifford.
Thank you.
Discussion, comments on the amendment. Representative Barth.
Thank you, Madam Chair. I do like the amendment where it does specify that it's older than 18. This I'm a little bit torn on what direction to go, because I do think pharmacists are looking for expansion options. There is, I think, a risk factor in doing this that does concern me, but if we are assured by them that this is something that they're covered by liability insurance and they are full informed consent to patients, all risks known and alternative options, then that is something that I want to make sure and confirm that we have that as part of it.
Well, and I can tell you just from personal experience, because I did my pneumonia shot with a pharmacist, I did my shingle shot with a pharmacist, I do my flu shot every year with a pharmacist, and I get plenty of paperwork to walk out with. I think some of them have more paperwork than others, but.
And this does not apply to the COVID vaccine. Is there anything that we need to add that specifies that? You said it didn't.
No.
No.
Rochelle, you want to, I'm not the expert here, so we'll ask Representative Barth. You're fine.
Again, Rochelle Colombo, Kansas Medical Society. This does not provide authority for a pharmacist technician to administer the COVID vaccine. As Mr. Dunkel outlined, they had, under the PrEP Act, they were given that authority. That does expire. It would have to be put into statute to specify that the COVID vaccine was included in that. And again, so this is only for the flu shot for those sick between 6 and 12, and then other vaccinations for those 12 and older. But I don't believe it would apply to that unless I'm incorrect. For those 12 and older? I'll defer now to
Go ahead,
Mr.
Aaron,
Dunkel.
you can step up too. We'll have the Aaron Rachel show.
There you go. So right now, it's still covered under the PrEP Act. When the PrEP Act would go away, then if, through the protocol with the physician, if COVID was added to those protocols as one of the covered vaccines, that would give them the ability to provide that vaccine. But PrEP Act goes away, they don't get it added to the protocol as one of the listed vaccines that they can do under the auspice of the doctor, then no, then they wouldn't be able to do it. But that's the same way with any vaccine or any age group.
But a minor just cannot walk in there and ask for this vaccine. Their parents have to be with them.
Correct.
And it falls under the physician protocol, so
Right.
it's the physician's liability.
Can I clarify?
Representative Epley.
Yes, thank you, Madam Chair. Just as a physician that has a protocol with the pharmacy locally, it just falls under the protocol that you have agreed to with that pharmacy, and it has to follow the statutes as they're outlined, as far as the age groups outlined in this bill and in the other bills that Scott referenced. Thank you.
Does that help, Representative Barth?
Yeah, I think as long as the liability falls on them and they are providing full informed consent, I do worry a lot about the experimental COVID vaccine and how that affects people and how that, I don't believe that I have had the experience through vaccines. It's been a different one when it comes to the COVID vaccine of being not fully informed the same way that we are with other vaccines. So that is a huge concern of mine, is that one piece of it, because there is a lot more risk. And I bring that up because
Now, they can't give the COVID vaccine except under the
but
PrEP Act.
when will that expire and when will that be a part of it? That's the other
We
question.
don't have a date on that, do we yet, Aaron?
Because is that part of the emergency use authorization that's coming up to an end here any day?
No, that's part of the public health emergency declaration. The PrEP Act component, which is all the things they did that allowed things like the additional telehealth and these vaccine components under the pharmacy pieces, that's all set to expire October 2024.
And the only other reason I bring that up is just the VAERS data that I don't know that's being fully disclosed to everyone with the safety risk of, associated with the COVID vaccine. So that is the one thing I have the main concern on. So I just want to be clear because I don't understand exactly. Under this bill, the COVID-19 experimental vaccines fall under the PrEP Act, meaning, is that what I'm understanding? And
Yes.
that they, under the PrEP Act.
Aaron, you want to step up, is that all right? You or Rachel, either one. Rochelle, excuse me.
And
I don't know why I want to do Rachel on
Just
you.
a simple answer,
after
because
all
I don't
these
want
years.
my brain wanders sometimes when you answer too much as I'm thinking about the next thing a little bit here. So the PrEP Act, the COVID vaccine is or is not available through the pharmacies or to be administered down to what, tell me, I mean, I guess just,
Under
I'm
the
not
PrEP Act,
clarifying that very well, sorry.
Yeah, under the PrEP Act, that's really, that version in the EUA and now the transition over to the FDA authority and CDC work, the CDC authority, that is now, it's kind of transitioning away from just being EUA, from the emergency use authorization. And so the actual administration in the pharmacy by the technicians will continue to be covered as an allowed activity under the PrEP Act until it goes away. But all the other components around things like the COVID vaccination and other vaccinations, that's all part of a completely different conversation.
Yeah, I think if we could basically add or amend where we could change it so that the COVID vaccine, because it is still an experimental, was not part of this, would be more acceptable, but I don't know if we can do that or not.
Well, we could, I'm just not sure that we have, that maybe the desire in here is to do that, but we can ask. We're on another motion right now, Representative Epley.
Just to speak to the motion and for clarity, and if there's an exception in the PrEP Act, please correct us. This COVID vaccination is not, it's not on EUA anymore. It's fully been vetted and it's passed out by the CDC. It's like every other vaccination. It's on the recommended list, not the required list. It's on the recommended list, and that's it. It's keep using the words experimental, and that's kind of like the boogeyman in the room, and it's not experimental. It is, it's fully approved vaccine now for recommended application for the age groups in the United States. Thank you, Madam Chair.
Questions or comments on the Epley Amendment of 18 years of age or older? Seeing none, all those in favor, or Representative, you may close.
Oh. Thank you, Madam Chair. I close.
All those in favor signify by saying aye.
Aye.
Opposed, no. Ayes appear to have it. Ayes do have it. Motion carries. Back on the bill. Questions, comments on the bill? Did you have something, Representative Barth? Do you have something on the bill? We're back on the bill now. We were on an amendment earlier. We just got done with the Epley Amendment, which was 18 years of age or older, and
I'm sorry, I
on
want to
line
change it
8
to an I
after
on the
is.
18 years.
Huh?
I'm going to change it to an I, the yes, the
Okay.
yay on the 18, sorry.
All right. Now we're back on the bill with an amendment. Questions, comments on the bill? All right. Seeing none, Representative Epley, you may close.
Madam Chair, I would like to move that we pass House Bill 2263 out as amended favorably for passage.
All in favor signify by,
Madam Chair, Clifford
no, we
seconds.
already had a second with Clifford.
Not on the
Oh, not on the amendment.
amended bill.
The amended bill. Seconded by Representative Clifford. Thank you, Dave. All those in favor signify by saying aye.
Aye.
Opposed, no. Ayes appear to have it. Ayes do have it. Motion carries. Doesn't make any difference. Only if they ask for their vote to be recorded, and then they can have Dave record their vote. Are we done, Scott? Okay. All right, committee, now we're on to the third bill that we've got, and that would be, we're going to open up the hearings on House Bill 2260. And Revisor Abbott, if you'll please explain the bill.
Thank you, Madam Chair, members of the committee. House Bill 2260 was also sponsored by this committee. The bill would have been provisions of law relating to the Medical Student Loan Program. This is a program that provides stipends to medical students who, in return, agree to fulfill certain practice requirements. The bill would change two provisions of that program. First, current law states that medical student loan agreements are limited to 6 individuals who commit to satisfy practice obligations by serving at KU Med in general psychiatry or child psychiatry, or at least 100 hours per month of on-site mental health care. This would increase that to up to 12 individuals subject to appropriations. It would also provide that KU Med would be prohibited from creating any substantial impediment to a student switching between approved postgraduate residency training programs. The bill would take effect upon publication in the statute book, and I'd be happy to stand for any questions.
Are there questions for Revisor Abbott? All right, seeing none. Oh, wait, excuse me, Representative Orpeza. I'm sorry, Dave's head is right there, so you may have to just, yeah. Thank you.
Thank you, Madam Chair. Revisor, what is the current practice? Like, do we just have 6 now, and then we're just expanding it to 12?
Yes, Madam
Is that
Chair,
right?
Representative.
Okay.
So current law states that it's subject to appropriations, but it can be up to 6 in current law. This would increase that cap to 12.
Thank you.
Okay. Committee, further questions? All right, seeing none. Thank you very much, Scott. All right, committee, we have proponent. First one, we have Kyle Kessler, Executive Director, Association of Community Mental Health Centers of Kansas. Welcome to committee, Kyle.
Good afternoon, Madam Chair, members of the committee. I'm Kyle Kessler, Executive Director at the Association of Community Mental Health Centers, and we represent all 26 licensed mental health centers around the state. We appreciate the opportunity to bring to you House Bill 2260, which we asked for introduction of, and we certainly support it. And when we came in front of you all a couple weeks ago with our overview of the Kansas CMHC system, this was one of the items that we talked about in terms of our workforce initiatives. That was part of our public policy agenda. And this would, as the revisor mentioned, increase the number of slots from 6 to 12. And when we were looking at different things that we needed to look at both clinically and medically, this was one of the things that we had passed in the 2017 legislative session, and we've seen a little bit of usage of this program, but we don't believe nearly enough. So this was something that would allow people to, if they start their residency in one area, they could transfer a little more easily to psychiatry. And I'll just give you a couple. We have statistics in our testimony, but just to give you a couple quick anecdotes for what we hear around the state. Lawrence, Kansas City, Topeka, Wichita areas are where 95% of the outpatient psychiatrists practice, and every one of those communities tell us we have a shortage of psychiatrists. So you can imagine what that means to the other 5% of the state. And several years ago, I was out in Dodge City providing or giving a presentation about our workforce issues to community mental health center executives and law enforcement and legislators. And one of the statistics I cited was that we only had one practicing child and adolescent psychiatrist at a mental health center west of I-135. And at the end of my presentation, I had a couple mental health center directors come up to me, one from the Garden City, Dodge City area, and one from Horizons, and asked me where that one child and adolescent psychiatrist was because they thought I had rounded up. And so other than being a humbling experience, and they said, well, if you're talking about Dr. So-and-so, he retired 3 years ago, and I didn't know that it wasn't who I was talking about. So I said, well, it's clearly we need to do more work on this issue. And the other one, again, a mental health center in Southwest Kansas that had lost their medical director a few years ago. they were advertising in Albuquerque newspaper, Denver newspaper, Oklahoma City, everywhere they could. And it was just a challenge to get psychiatrists. And again, it's something that I mentioned when we lost the Menninger Clinic several years ago. We had no idea what we were losing in the late 90s when it relocated to Houston, Texas. I mean, the number of residents as well as the number of social workers, psychologists, and nurses was just a gut shot to our system. So with that, Madam Chair, I would stand for questions at the appropriate time and ask for the committee's support.
All right, I think what we'll do, Kyle, we'll go ahead and hear from Dr. Warren, and then we'll come back to you.
Sounds good.
Questions.
Thank you, Madam Chair.
Next committee, I have Dr. Will Warren, Medical Director, Association of Community Mental Health Centers of Kansas. Welcome to the Capitol. We don't see you very often, and it's been a while since I've been on a committee with you.
Thank you, Madam Chair. Thank you, members of the committee. My name is Will Warrens. I'm a child and adolescent psychiatrist practicing up in Leavenworth and Atchison and Oskaloosa, covering that three-county region up in northeast Kansas. I'm also the medical director for the Association of the Community Mental Health Centers of Kansas. And I am here in support of House Bill 2260. I arrived in Kansas in 2011. I had at that time been a family practitioner up in rural Nebraska and had just finished my psychiatry training at the University of Iowa. I had to put my loans in deferment for that time. This was an unplanned deferment. And well, my wife living in Wamego, I'm from Bellevue, Nebraska, so I was looking at northeastern Kansas, but I wanted to keep treating in the rural underserved population. I didn't want to go to where the more lucrative positions were, which would be in typically the more urban centers. One thing that helped me do this was the National Health Service Corps. The Guidance Center is a National Health Service Corps site, and I was able to get enrolled in the National Health Service Corps loan repayment program. So over the next 5 years, in addition to being able to work with the patient population I wanted to work with, I was able to exit with my loans fully paid off. But over those 5 years, I also was promoted to medical director. I developed a love for mental health treatment. I became bonded to the CMHC safety net system in Kansas. I couldn't see myself practicing anywhere else. And I liked the CMHC holistic approach to care, medication services, therapy, rehabilitation services. And I was bonded to my communities. So here, 11 years later, I'm still there and have no plans of leaving. So for me, this program worked. In addition to this, since that time, I've had a physician assistant and a nurse practitioner participate in the state loan repayment program successfully and had multiple years of them participating in that program. One is still in that program. And I think that is a piece of the component of what helps cement them in their positions with the Guidance Center. So I think it's been very effective. I do like, this isn't in my testimony, but I do like the fact that we are proposing to allow physicians to change their specialty but remain in the program. A lot of these young physicians are in their mid-20s and they're very serious individuals, but in some ways they're still adulting a little bit. They haven't found, many of them haven't found their significant others, haven't developed their family or their life course, and there's many things that could shift them off path of what they think their path is. And to allow them to change their specialty in medicine but stay in this program and then practice in Kansas, I think would be awesome. So thank you, and I stand for any questions.
All right, now committee, we'll take questions. Are there questions for Dr. Warren or for Kyle Kessler? Well, you two gentlemen must have done a great job. Representing Hasswood.
Thank you, Madam Chair. In the bill, in section C on the first page, it's talking about a $2,000 per month stipend. Is that from the University of Kansas Medical Center?
I'm not sure.
Because I don't see it in the fiscal note.
And Representative, it's a program that's subject to appropriation. So for example, yeah, it would come through the medical center, but the example I give is that they recently lapsed $300,000 or $400,000 from this program because it just wasn't being taken advantage of. So we believe that that's in there.
Do you think that will increase?
And we had not asked for it to as part of this bill.
Okay, I just think 2,000 is a little bit low for students, but thanks.
All right. Are there further questions, committee? Or PESA?
Thank you, Madam Chair. My question is can the medical students just automatically pay that loan out and move to another state? The $2,000 per month that they would receive, which is about $24,000 a year? Is that a way to opt out of staying here in Kansas?
Oh, you mean if they decided to break
Yes.
program?
Break program, yes.
I can't speak to this one per se. I do know that there was severe penalties for breaking the programs in the National Health Service Corps and some of the other loan repayment programs, but I'm
Kyle,
not sure
do you
on
have
this one.
answers too?
Well, and if the program is, or if the agreement is between the medical school and the provider, or between the provider and the resident more likely, then those are in writing, and I believe it requires a payback.
Because the goal is for us to keep, if we help finance them, we want to keep them here and use their service. Now, is there a guarantee after a period of time, that maybe they meet their significant other and they're off somewhere else, like Dr. Warren ended up back in Kansas because his wife was from Amigo. So sometimes you never know when you'll get back here to Kansas. Does that help? Representative Berquist.
Yes, thank you, Madam Chair. To either one of you gentlemen, with the possibility of changing to psychiatry, is there a likelihood, does it seem that there would be some follow through with that? We hope for it to happen, but does it seem like there's some that are interested that would be able to follow through if they had that opportunity?
You mean if they start off in one specialty and then switch to psychiatry?
Correct.
I would be very hopeful of that. I think that a lot of physicians come into medical school and might be targeting things that are very attractive, maybe Hollywood attractive, trauma, brain surgery. But I think they become impressed with the direct patient care and the intimacy of the patient care in psychiatry. And I think psychiatry does win over a lot of residents that way. So I would be hopeful for that as well.
Thank you, Madam Chair.
Okay, further questions of these two gentlemen? All right, seeing none. Then I have Amy Campbell, Kansas Mental Health Coalition. Welcome to committee, Amy.
Thank you, Madam Chair. My name is Amy Campbell. I work for the Kansas Mental Health Coalition. The coalition is a roundtable organization of over 40 associations, companies, community mental health centers, hospitals, advocacy organizations, and others. We meet once a month to create a consensus agenda to bring before you as the Kansas Legislature. On my testimony, I've included some of the bill language on the first page, and I won't repeat what's already been gone over. I would just emphasize to all of you that if you have not had a chance to look at the report from the Mental Health Modernization and Reform Committee and the work that they have done, or the 2019 Mental Health Task Force report, you will see that a number of people have come together to combine their expertise and make recommendations to improve our mental health system in the state. This aligns with those goals in attempting to boost our workforce, particularly on the clinical side, and adding psychiatrists to our state. One thing about social media and websites is that my name is now out there with the Kansas Mental Health Coalition. And if I could tell you the number of parents that I hear from who simply cannot access a psychiatrist in any amount of reasonable time with a child or with an adult child who is in trouble or is in crisis, it is heartbreaking. So anything that we can do to boost the options to make going into this service more attractive to people and to increase the number of psychiatrists we have in our state will be beneficial for our state as a whole. Thank you, Madam Chair.
Thank you, Amy. Are there questions for Amy? And I appreciate you bringing up the work that we've done the last few years with our different committees, because I think it spelled out a lot of things, and this was one of the things that was talked about multiple times, is how do we get more people out there. So thank you. Appreciate
You all
it.
spent a lot of time on it, so thank you.
Oh, my God. Dr. Warren was also involved in many of those meetings. Now we have, I have no more proponents. There was 0 on opponents. I have proponent written only by Rochelle Colombo, Executive Director, Kansas Medical Society. Is that correct, Rochelle? All right. Okay, seeing none, no further, we'll go ahead and close the hearing on House Bill 2260. Representative Epley.
Madam Chair, assuming that we will go
Oh, wait a
forward.
minute. Without
Make your
objection.
statement.
Yeah, without objection, we'd go ahead and work House Bill 2260. Now I will recognize Representative Epley.
Thank you for the recognition, Madam Chair. And having said that, I would move that the committee pass out House Bill 2260 as presented today favorably for passage.
Motion made by Representative Epley, seconded by Representative Reese. Questions, comments on the bill? All right, seeing none, Representative Epley, you may close.
I close, Madam Chair.
So you are asking to pass out the bill favorably?
Yeah, as I stated, I'd
For
like
passage.
to pass out House Bill 2260 favorably for passage.
Motion made by Representative Epley, seconded by Representative Reese. All those in favor signify by saying aye.
Aye.
Opposed, no. Ayes appear to have it, ayes do have it, motion carries. Bill is passed. Okay, committee, that is it for today on bills. Tomorrow we have House Bill, what, Dave? 2064? 2264. All right, so committee, we are now adjourned until tomorrow at 1:30.